Hi everyone, welcome back to my YouTube video channel. This is the video which summarizes partially the root canal procedure, how the dentist would do inside your molar canals. This is a case where the patient already have a crown, but he has symptom that been hurting him long enough that's required to take out the crown. So we took out the crown and we drew on top of the tube. We went inside and searched for 3 canal. This is tube number 30, the lower right molar, first molar. So I were able to find 3 canal. The distal canal that I'm doing right now is to go down and clean to the apex part of the canal. You notice that I'm using the wave one technology. This is I would consider one of the best technology out there in endodontist treatment therapy for patient. Very effective, very progressive, very predictable when you want to finish your case, especially those who have long curved calcified canal. Wave one fire, which works amazingly great. So that would be the reason why I love wave one technology. I would encourage dentists who do root canal should buy wave one and try it yourself. It's very good product. After we do this, we're gonna irrigate at least 3 to 4 times before we seal up the canal. So this is one of the first primary irrigation. Allow the smear layer to be removed, and as you can see, the technique, the tactile way of doing irrigation, you don't force the irrigation material under the apex. That would be detrimentally toxic to the body. So you gently go up and down for motion, allow the suction to remove the smear layer, go back and forth like that, but not push forcefully down. Whether at the mandibular or the upper arch can be very, very, very dangerous to the body. Be extremely careful. I'm using the dry seal technology. Allow me to do this one without doing the root canal, rubber dam. Save you a lot of time, and it's give you more visibility for you to see what's going on at the gum level as well. Because once you put the rubber dam in, it's hard to see anything. So anyway, now I just tried use the gutter pressure, different size and shape, try the canal, and that's what I'm doing right now. Go and try different size and shape up the gutter pressure. Go down and clean the canal well. Very important to make sure that the what you are confirming at the apex part is clean, no infection, as much as possible. You do it like this, and if you see that you take an X-ray and you see it's short, then you got to go back and continue remove some more smear layer of the canal. So that's what I'm doing right now with the smear layer of the link mesobuccal and canal, trying to clean and go deeper. So yeah, that mesobuccal right there, and yeah, this wave one is just amazing. I would be afraid if I use a pro taper and doing the same thing like this. Always stressful. But when I start changing to wave one endodontist technology, I don't feel stressful at all. It's very flexible wire. Fire is a heated night ties, mean that when it go to body temperature, it's actually straight up, and when it's outside, it's actually cool down and curve, very flexible. This is allow you to go with in and out without worry about separation of the fire, which can happen several times with you doing the same thing with rotaper, GT fire. I remember, so tough, but this is a lot more stress-free I encourage endodontist or root canal specialists who haven't tried the wave one technology or the GP technology, GP who doing endo, try the wave one. You would love it, I guarantee, because this is really extremely aggressive but very predictable in terms of how it cleans and shape the canal. Notice I'm going back and forth to meso buccal and mesolingual several times to try to remove as much as smear layer, allow my gut temperature to go deeper as I try to seal up this canal. Yep, you hear my watch with the alarm telling me that it's 10 o'clock tonight. I love dentistry, guys. I'm just trying to show the young generation how to do this. As well at the end, whether you're a patient or whether you are a dental assistant trying to become an effective dental assistant, you should try to watch a little bit of these videos. So when your dentist work on a patient, you know what you're looking at. I'm trying to do just put the distal gutta percha in, and now I burned it. I burned right at the orifice, remove the accessory material, try to push down the rest of the material into the canal, the distal canal. That's what I'm doing. I'm trying to seal up the distal, and now I'm doing distal, the mesobuccal and mesolingual gutta percha. And yep, everything take time. So anything when you are questioned, you're not sure if you go deep enough to the apex, then you just cut right at the top part of the gutta percha, the occlusal side. Then you take an X-ray and see how it looks. If you love it, then you just go ahead and remove the rest and then seal up with the build-up material. And if you don't like it, you can just retreat it, remove, and go deeper. And so even though the root apex locator help you a lot, but there's nothing better than confirming the X-ray. And you're looking at the X-ray, it tell you a lot. Again, enjoy your day. Have a good day. Good night. Take care. Bye-bye. Please don't forget to subscribe my channel and follow with more YouTube video and dental education. Have a great day. Bye-bye, guys.